Hello, my name is Kaitlyn Ybanez,
My name is Rene Rico.
and the title of our project is Injectable Alginate Scaffolds for the dual delivery of minocycline and temozolomide for the treatment of glioblastoma. Glioblastoma multiforme is one of the most invasive types of brain cancer, for it targets the supporting cells of the central nervous system known as astrocytes. GBM tumors proliferate by forming new blood vessels, a process called angiogenesis. Upon presentation, GBM patients have a short life expectancy due to the fact that even after treatments such as tumor resection, chemotherapy, and radiotherapy, a high chance of reoccurrence still persists. This is because GBM tumors are not as clearly defined, and its endings can stretch farther than assumed. Therefore, an intuitive treatment approach is essential in combating GBM. We hypothesize that injectable alginate scaffolds can be constructed to retain anti-cancer drugs such as minocycline and temozolomide and be injected to the defect after tumor resection. Alginate is a reliable gelling biomaterial that could be used as a component for fabrication. An injectable scaffold will allow for the site of interest to be refilled precisely and release drug. Our objective is to fabricate injectable alginate-based gel scaffolds for the dual delivery of minocycline and temozolomide for the treatment of glioblastoma. Hence, scaffold integration may lower the possibility of reoccurrence by strategically releasing drug over a specialized period of time. Now, as for the methods, scaffolds were fabricated according to the concentrations deemed to reach the desirable pH range of 6.8 to 7.2. By setting sodium alginate and calcium carbonate at a 1-to-1 ratio, 3 groups were formulated: 0.5% weight per volume, 0.75 weight per volume, and 1% weight per volume. The percentages indicate the amount of sodium alginate and calcium carbonate in grams per milliliter that is used to make the gel. For example, 0.05 grams of both sodium alginate and calcium carbonate was utilized in the 0.5% weight per volume group. To begin fabrication, sodium alginate and calcium carbonate was dissolved in 9 mL of distilled water in a separate scintillation vial per group, while 0.25% weight per volume of GDL was mixed within 1 mL of distilled water in a microcentrifuge tube. 1 mL of the GDL solution was then added to the sodium alginate calcium carbonate vial and homogenized for 20 seconds. At this point, a pH study was conducted by inserting a probe from a pH meter into the gelling solution. Changes in pH was recorded at 5 time points. As for the gelation time study, a similar process was followed, but scaffolds were timed on how long it took for the solution within the vial to gel completely by using a digital stopwatch. When the gel within the vial did not slide when placed at an angle and upon inversion, the solution was said to be entirely gelled. Lastly, scaffolds were fabricated by pipetting 300 microliters of it into a 96-well plate. Scaffolds were removed from the plate when entirely gelled, and wet dimensions were recorded for n=3 by using a digital caliper. Wet weight was also determined by placing the scaffold onto a weighing boat on a weighing scale.
Before reading the results, it is important to note that the pH needs to fall within a certain range, which is 6.8 to 7.2, so that it does not cause harm to the body somatic cells that surround the glioblastoma resection site. It is also essential for the gelation time to not be too sudden, but long enough to allow for the scaffold to fill in the site where the tumor was removed. Table 1 shows the dimensions of our scaffolds after gelling in a 96-well plate. The averages and standard deviations were calculated for each group at n=3, or 3 triplicates per group. As you can see, the heights and diameters of the scaffolds for groups 0.5%, 0.75%, and 1% were found to be non-significant after conducting a 2-piece test. As for the wet weight, there was a statistically significant difference between scaffold concentration of 0.5% compared to the other groups. In the pH figure, we have the averages and standard deviations that were calculated for each group at n=3. We see that group 1% of sodium alginate and calcium carbonate in orange had the highest pH value with an average of 7.15 at 60 minutes. Group 0.75% had the second highest in blue at a pH of 7, and group 0.5% had the lowest pH value of 6.74, as you can see in green. The gelation time figure demonstrates the amount of time it took for the scaffolds to gel at different concentrations at a ratio of 1:1. The averages and standard deviations were calculated based on 2 observer values at n=3. Group 0.75% had the shortest gelation time at an average of 8 minutes and 31 seconds, while group 0.5% had the longest gelation time at an average of 15 minutes and 46 seconds. A Tukey's test determined that scaffold concentration of 0.5% was significantly different compared to the other groups. In the study of wet weight and dimensions, we observed that scaffolds with a sodium alginate and calcium carbonate concentration of 1% were the most consistent in scaffold shape after gelling in the 96 well plate. We believe this is due to the 1% group having a higher concentration of sodium alginate and calcium carbonate, where more cross-linking of the alginate polymers by calcium ions occurred. The wet weight of scaffolds at a concentration of sodium alginate and calcium carbonate at 0.5% weighed significantly less compared to the other groups. The heights and diameters of the 3 groups were non-significant. However, the scaffolds can continue to be integrated into the site of tumor resection to serve its purpose since it is injectable. In the pH study, we wanted the pH range of our scaffolds to fall within a 6.8 to 7.2 range, as we learned from other journals that this was a favorable range for drug delivery and the avoidance of cellular cytotoxicity. We were able to achieve this goal for scaffolds at sodium alginate and calcium carbonate concentrations of 0.75% and 1% after a 60-minute duration. Group 0.5% almost fell into range at the 60-minute time point, but fell short at an average pH value of 6.74. We learned that the pH of our scaffolds could be tailored and that an increase in sodium alginate and calcium carbonate at a ratio of 1:1 would make them more basic. Lastly, for the gelation study, group 0.5% was found to have a significantly longer gelling time than the other groups. We were able to learn from our gelation study results that we can lengthen the gelation time by decreasing the amount of sodium alginate and calcium carbonate compounds in the scaffolds.
In conclusion, increasing sodium alginate and calcium carbonate compounds led to an increase in pH, a shorter gelation time, and a sturdier gel. This investigation demonstrated the potential for injectable scaffolds to serve as an adjuvant therapy after tumor resection in patients with glioblastoma multiforme. The scaffold will be able to refill the defect site of the tumor so that it can release anti-cancerous drugs like minocycline and temozolomide over time to eliminate any leftover glioblastoma cells that may have remained following this type of surgery.